As patients, carers, members of the Philippine Alliance of Patient Organizations, we breathe disease and death every day.
It is a struggle on all fronts, physically, mentally, emotionally, spiritually, and financially.
It has its disappointments, but also high points, as we encountered kind, healing souls along the way. But just when we thought we had it tough, COVID-19 made our fears bigger and deeper.
We cannot afford another disease, nor can we afford to put up a fight on all fronts. This is not our fear alone. Never in the history of mankind that there has been a disease that destroyed and disrupted so many lives and hope all over the world.
The COVID-19 vaccine is offering us hope. It is not perfect, but at this moment, it is our best chance to stop living in fear and to start living in hope.
This will not work if only a few of us chose to be vaccinated. All of us need to get the vaccine because no one is safe until everyone is safe.
PAPO stands solidly with experts and advocates for COVID-19 vaccine. We invite you to join this call of unity as we launch Bakuna Now Na to address the infodemic and help increase vaccines acceptance.
Never in our history has there been a more urgent call to stand united, get vaccinated, so together we can overcome COVID-19.
Bakuna, now na! Bakuna, now na!
Bakuna, now na!
Bakuna, now na!
Bakuna! Now na!
Bakuna! Now na!
Bakuna Now Na!
Bakuna! Now na!
Bakuna, now na!
When it comes to how many kids Filipino couples want to have and how many kids they end up having, meron tayong nakikitang pattern. Parents usually end up with one child more than what they initially wanted. At ang pinakamahihirap na pamilya, sumusobra pa sila ng dalawa. Pag mas malaki ang pamilya, mas lumalaki rin ang posibilidad na maging mahirap ang pamilya. Poverty leads to children growing up not reaching their full growth and productivity potential. Responsible parenthood and family planning is one of the 3 program components of the Philippine Population Management Program. Tugon ito sa pangangailangan para sa epektibong pagpaplano ng pamilya. RPFP has 3 goals: 0 unmet need for modern family planning, pataasin ang paggamit ng modern contraceptives to 65%, at maiwasan ang di inaasahang pagbubuntis, lalong-lalo na para sa mga mahihirap na kababaihan. Sa RPFP, matutulungan ang mga couples na ma-achieve ang tamang pag-aagot ng pagbubuntis at ang bilang ng gusto nilang maging anak na kayang bigyan ng maayos na tahanan at kinabukasan. May iigtingin ng kampanya para maipatupad ang Responsible Parenthood and Reproductive Health Law at Executive Order No. 12 sa mga lokal na pamahalaan. We'll use communication campaigns to promote responsible parenthood and family planning, natural man o artificial methods upang tumaas ang demand para rito, especially among poor women and families. Ilalapit natin ang reproductive health services at contraceptive commodities sa mga mahihirap na komunidad para ma-access ng sino mang gustong magplano ng pamilya ang family planning method na hiyang sa kanila. With the Responsible Parenthood and Family Planning Program of the Philippine Population Management Program, we'll make sure that couples and individuals have the knowledge and support they need to start the family of their dreams. Empowering Filipino families.
Labanan ng COVID-19, ang kailangan natin ay tama at totoong impormasyon, hindi fake news. Huwag ka agad maniniwala sa nababasa at naririnig. Ang pagkalat ng mga maling paniniwala tungkol sa COVID-19 ay nagdudulot ng panik, takot at maling desisyon. Laging i-double check kung saan nanggaling ang nabasa o narinig. Maging mapanuri at i-share lamang ang tamang impormasyon. Sa wastong pag-iingat, ang virus hindi kakalat. COVID-19, kayang-kaya nating tapusin.
Patuloy pa rin ang laban natin sa COVID-19. And together, we can beat the solusyon.
B. Bawal walang mask.
I. Isanitize sa mga kamay. Iwas hawak sa mga bagay.
D. Kumistansya ng 1 metro.
A. Alamin ang totoong impormasyon tungkol sa COVID-19.
Protektahan natin ang sarili at mga mahal sa buhay.
BIDA. Be the solusyon sa COVID-19.
Magandang gabi po sa inyong lahat. Welcome again to Alaga Health Live. I am Doc Dexter Galban and I'm live at the Alaga Health Hub and also live on Facebook, on YouTube, and even on LinkedIn. And tonight we are celebrating the National Diabetes Awareness Week. And of course, hindi mabubuo ang ating Alaga Health Live sessions kapag hindi natin kasama ang ating mga special guest, ang ating mga medical experts. And of course, to kick things off, since we're talking about diabetes, maganda siguro na meron tayong specialist na pagdating sa field ng endocrinology. So, without further ado, let us welcome to the show for the very first time, the wonderful and amazing Doc Paulette Nacpil-Dominguez. Good evening, Doc Paulette.
Hello, Dex. Good evening. Thank you for inviting me. Good evening, everyone.
Perfect. So, now that we have the diabetes part covered, perhaps we can now introduce ito, laging requested. Always, people are messaging us regarding, kasama ba siya ulit sa Alaga Health Live? Kasi talaga namang celebrity doctor natin siya. And of course, I'm talking about none other than the wonderful and beautiful Doc Joan Perez-Rifareal. Good evening, Doc Joan.
Hello. Good evening, Dr. Dex, Dr. Paulette. Dr. Dex, maraming salamat for inviting me once again tonight. And of course, thank you for including me here for the National Diabetes Awareness Week. Maraming salamat. And Dr. Dex and Alaga Health team, really congratulations for everything, for all the good work that you do. Thank you.
Thank you, Doc Joan. And of course, hindi dapat mawawala pagdating sa field of healthcare yung ating primary care. And we have our own resident doctor for that. And she is none other than the amazing Doc Jucille Roderos.
Hi, good evening po sa inyong lahat. Good evening to all our viewers. Hello, Doc Paulette. Thank you for joining us. And Doc Joan as well. You both look radiant as ever. And maraming salamat po ulit sa pagtutok every week po, every Saturday night dito sa Alaga Health Live. Naku, marami na naman tayong matututunan kasi this one is very much important in terms of taking care of our health. Marami kasi sa atin ang mahilig masyado sa carbs. So we now have our specialist here. And of course, other lifestyle-related concerns that are not only very particular to diabetes, but other concerns about our health as well. And I'd like to take this opportunity to congratulate Alaga Health for winning in the Asian Development Bank's Smart City Award. And I'd like to take this opportunity also to thank everyone in the Alaga Health team for painstakingly working hard to be able to deliver healthcare anytime, everywhere, anywhere, in every way. Patuloy po kaming magsiservisyo po sa inyo at patuloy po naming pag-iigihin ng aming trabaho sa Alaga Health para po maalagaan po namin kayo. Again, thank you very much, Asian Development Bank. Talaga namang Philippine pride, kasi Doc Dex, we were contending against international contenders. So again, congratulations and to the Alaga Health team. Lahat po ito ay inaalay namin sa inyo, and of course to all our doctors. Thank you for being a part of this success as well.
Thank you very much for that, Doc Via. And as she mentioned, actually that's our big news for the week because Alaga Health was actually granted by the Asian Development Bank with $10,000 as part of the Smart City Hackathon Grand Finals, meeting other countries around the world. Also would like to say hi to our co-finalists in that event from Nepal, from Canada, from India. And we're happy to have represented the Philippines proudly in that competition. But then again, balik tayo sa Alaga Health Live, Kasi pagdating sa healthcare, hindi lang naman puro mga doktor ang dapat kausapin. Kasi we have so many allies in health. And also, as a nurse, talagang ibibida ko to dahil siya ay actually registered nurse also and is the president of the Philippine Association of Diabetes Educators. None other than Nurse Leyden, Florido. Good evening, ma'am. Welcome po to Alaga Health Live.
Hi, good evening. Good evening, doctors. Hindi ko na po iisa-isin. And thank you, Dex, for inviting me here. This is the first time that na-invite ako sa ganito and live. Sabi ko, medyo kinakabahan yata ako. Kasi ang kaharap ko is mga experts on their field. And though, of course, I'm a nurse, sabi nga, expert on diabetes education. Sige na. Aminado na. Thank you so much, Dex.
Thank you, Ma'am Leyden. And since it's the Diabetes Awareness Week, maybe it's time for a very quick check-up. There you have it, Alaga Health Checkup. That means we're going to be talking about our hot topic for the week. And since it's the National Diabetes Awareness Week, maybe we can ask Ma'am Leyden, why do we celebrate the National Diabetes Awareness Week? What is this celebration all about? Para lang po aware yung ating mga viewers.
Yeah. Kasi noon pa, kanino pa panahon pang presidente yon, and we really have this Diabetes Awareness Week because we want to focus more on the prevention of complications of diabetes and promotion of health so that people will be healthy and avoid to have diabetes, because we know tumataas ang prevalence rate ng ating diabetes in the country. Kaya noon pa man, naisipan na let's celebrate diabetes awareness so that people, lahat ng tao po ay maging aware na pwede nating i-control kasi ang diabetes. We can control not to add on to the statistics of having diabetes. That's why we have this Diabetes Awareness Week, to promote health and to prevent the progression of the diabetes and its complication. Yun eh. We have to be aware. Everyone is aware. Not only people with diabetes and the significant people, but all over the Philippines, lahat ng tao dapat maging aware na pwede nating i-control not to have any kind of diabetes. Yun.
No? And since we're done with our checkup, no? Now, we will introduce something new to Alaga Health Live. Lalagyan pa natin ng extra level ng pagka-live. Kasi dati, sinasagot lang natin ang inyong mga questions through the comments. When you comment in our post, sinasagot ng ating mga specialists. But today, for the very first time, we will be having our live patients ask our health specialist directly. And to kick things off, we'd like to welcome to Alaga Health Live our very first live patient, or patient who's attending here live, Ma'am Annabelle. Good evening, Ma'am Annabelle.
Good evening, Doc, and good evening to everyone.
It's a pleasure to have you here, Ma'am Annabelle.
Good evening po, Ma'am Annabelle.
Doc. Nice meeting you all. Hopefully, we could have a very good meeting, as well as hopefully I can be one of your patients as well. Okay?
Thank you, Ma'am Annabelle. So, Ma'am, very quick lang po, no? So, madalas po ba kayo nanonood ng Alaga Health Live, or is this the first time?
Actually, this is the first time I've seen that in my Facebook, and then nag-register ako. It took me about few minutes lang, then I was there.
Wow, ilang minutes ba bang register sa Alaga Health Live? Ano ba kabilis?
Siguro mga wala pa nga 5 minutes yun eh.
Wow.
So it's so quick. Yeah.
Perfect.
Then I have verified my account to my email, and that's it. And then nakita ko yung email na sabi, you can send this to our comment box. So I have copied the one that has been sent in my email. Then yun na. And I was so surprised that I was one of your patients now. Okay, here in Alaga Health. Actually, I'm really browsing for a telemedicine because I wanted to be seen by endo. So kasi I've been diabetic for 15 years. And then I am on oral meds. I'm well controlled because I am also a diabetic educator, so I can control myself. So that was in 2016. I was working abroad. Then I was a diabetic educator. I had my certification from Aarhus University in Denmark. Then that is how I controlled my diabetes. Kaya lang ngayon, I'm a little bit worried kasi nga, because of the pandemic, I'm doing my online classes, medyo tumaas yung aking A1C. Ang A1C ko never have shoot up. Parating nasa 6.5.
It's because
yeah. Kasi nga, I'm sitting for 8 hours, then I didn't have the time for exercise. Alam naman natin ang online classes, it's really taxing at saka talagang stressful. And then at the same time, though I am following my diet, still nag-shoot up ng 7.4. I'm only on oral meds, and then kasi nga one of my issue now, one of the requirements in our school, I'm working in Our Lady of Fatima University as clinical instructor. So one of the requirements, I have to lower down my A1C. Yan nga ang question ngayon kasi nakikipag-argue nga ako sa medical doctor namin. Doctor, kasi once you are a diabetic, okay, it's so difficult to lower down the A1C. Though, I am controlled. I'm taking my medications, and by God's grace, I don't have my complication. Doc, I just did my retinopathy exam, so I'm clear, I'm free. Then my ECG is okay. And then my EGFR is 73. I think still within the normal range, right, Doc? If you're going to check my EGFR, so it's 73. Is it mild or normal, or I don't know what is the classification in here? And then I'm taking now glycoside 60 and BD for metformin, but as of this time kasi yung ating diamicron is out of stock. So lahat ng mercury pinuntahan na namin, wala kaming diamicron. So I'm just sticking with metformin, then I see to it na yung diet ko, yung carbs ko, it's really counted. So I'm using the plate method. And then I do ensure that yung aking carbohydrates is really controlled. Kaya lang ang issue ko, Doc, how can I lower down my 7.4 to 6, below 6? Eh sabi ko nga sa doctor ko, Doc, if you want me to lower my A1C to 5.4, that is the classification for normal. And I'm not normal, I am diabetic. Neither I'm not a pre-diabetic. Kasi may classification yan eh. Kaya nakikipagtalo ako, kaya I need to see my endo. How can I do it and how can I lower down? Now I'm doing my exercise daily, 15 minutes daily, to ensure na pag nag-test ulit ako after 3 months, then I would see that my A1C will come down. Kasi Doc, kaka A1C ko lang nung May 5. So wala pang 3 months. So hopefully by May, June, July, August, I need to have another A1C.
Yes, thank you, Ma'am Annabel. No? Ang masaya sa question ni Ma'am, parang nagkaroon na siya ng quick rundown ng lahat ng mga kailangan mong i-discuss pagdating sa diabetes. Ang swerte, Ma'am Leyden, baka gusto niyong kunin si Ma'am Annabel as part of your Association of Diabetes Educators.
Ayun nga, tatanong ko, Ma'am, how can I be with one of your members of diabetic educator? Kasi I came back in 2017. So from there, 2016, nag-stop na akong mag-teach. Mag-diabetic educator. Then eventually, nag-shift ako sa teaching. Yes. But though, yung aking teaching ko is sa school. So though, yung knowledge ko is still there. So I don't know how could I involve myself? Is there any certification here? Pero Doc, wag na kasi I'm already 65.
Doc Paulette, I think kayo po ang authority to answer yung question ni Ma'am Annabel. So, the floor is yours.
Yeah. Thank you, Ma'am Annabel. So, again, I'm Dr. Dominguez. I am an endocrinologist po. Thank you po for all the information that you gave us kasi it made our parang interview or parang consultation very very smooth flowing, parang binigyan niyo sa amin lahat ng information. But again, as tamang-tama po lahat ng nasabi nyo to promote nga po yung diabetes awareness week natin. So, in our society, we're also trying to promote ano yung sinasabi namin mga dapat gawin para sa diabetes. So, meron nga yung 4 dapat laban sa diabetes. So, nabanggit nyo po, tamang pagkain o wastong pagkain, si Ma'am Leyden mamaya, sasabihin niya yon, ehersisyo, pag-inom ng mga gamot at pagkonsulta sa doktor. So yun po yung sinasabi namin 4 dapat lagi para labanan ng diabetes. So, umpisahan po natin. So sabi niyo po, mamaya na po yung pagkain kasi si Ma'am Leyden mukhang marami sa ating matuturo kung paano din. Okay? Pero yung tama po yun. Kung alam po natin paano yung sinasabing pinggang Pinoy, diba? Yung pinggang Pinoy po natin, meron po tayong gulay, meron po tayong carbohydrates, mga 33% each. Tapos meron din po tayong mga karne at saka po yung mga prutas. So yun po yung parang balancing pagkain natin. And then next po is yung ehersisyo nga po. So for mga pasyente pong may diabetes, ang recommendation po talaga ng sinusundan natin sa American Diabetes Association din at saka may iba pa pong mga organisasyon is sana po exercise tayo at least 30 minutes a day of moderate aerobic exercise na hindi po sana bababa sa 5 beses sa isang linggo. So, yun po sana ang recommendation natin for mga pasyenteng may diabetes. Pero po, parang dahil nga po, diba, nagkaroon po tayo ng pandemic, may quarantine. So, marami po sa atin talaga medyo nalimitahan po yung paggalaw natin. So, pwede po natin gawin yung gradual, babalik tayo sa parang ehersisyo natin. Hindi naman natin kailangan biglain. Ang importante po, alam natin na kailangan po natin isama yon para malabanan ng diabetes. Pangatlo po is yung gamot natin, no? Yung gamot natin para sa diabetes. So nabanggit niyo po may glycoside at metformin po kayo. So pagkakatanda ko, tama po ma'am, sabi niyo po, no, parang 15 years na po kayong may diabetes.
Yes,
Tama
yes.
po. Okay.
On oral med.
So kayo mga 50 years old po. So actually ma'am, tayo pong mga Pilipino, isa po tayo sa mga lahi na mataas po ang risk na magkaroon ng diabetes compared po sa ibang mga lahi. Okay? Pag kunyari po sa Amerika po, ang screening po ng diabetes nagsisimula sa kanila 45 years old. Unless po meron silang mga ibang risk factors. Sa atin po sa Pilipinas, dahil po yung lahi natin mas mataas ang risk maging diabetic, 40 years old pa lang po, nire-recommend natin mag-screen na po for diabetes. Mas maaga pa po kung may ibang mga risk factor tulad po ng meron po tayong first degree relative na may diabetes or nagkaroon po tayo ng gestational diabetes. So yun po yung mga iba pong mga risk factors. So para sumatotal po, meron na po tayong 15 years na po may diabetes. Ang diabetes po kasi ma'am, parang progressive po siya na sakit. Okay? Hanggang ngayon po, wala pa rin tayong lunas na nadidiscover na sasabihin gagaling po tayo, especially sa mga type 1 and type 2 diabetes. Pero kaya po natin siya kontrolin. At dahil yun po yung natural history ng diabetes, in-expect po natin na dahil ay unti-unti po siya parang lalala para magpo-progress po siya. Yung iba po, mabilis. Pagka nalaman po nilang may diabetes, ilang taon lang po, parang ang dami na po nilang komplikasyon. Pero tulad po nung sa nangyari sa inyo, yun po yung gusto natin. Kahit medyo matagal na po tayo may diabetes, dahan-dahan po yung pag-progress. Dahil po, nung una nating nalamang may diabetes tayo, na-control po natin agad. So yun po yung pinaka magandang panlaban natin for diabetes, early intervention of our diabetes, early control po. So, we expect po usually, ma'am, after 10 years, doon natin unti-unting makita yung mga complications. Pwede magsimula po doon sa micro-complications na sinasabi nila, mga effect po sa mata, tulad itong sinabi niyo po, na-screen po kayo for retinopathy, wala po, or kung nagsisimula na po ba tayo magtapo ng protina sa ihi, ibig sabihin po, meron tayong nephropathy, parang pong komplikasyon sa diabetes, ay sa kidneys because of diabetes. So maganda po na wala. Pero doon ko po gusto sana sagutin po yung sasabi niyo po na bakit po biglang tumaas ang HbA1c ko? So marami pong dahilan. Una po, nasabi natin, dahil nga po medyo naging online po tayo lahat, nasa bahay lang tayo, nabawasan po yung physical activity natin. And minsan po, dahil diba, marami po sa atin parang siguro aware, or gato rin na nangyari dahil for a long time, nilang tayo nagkaroon ng matagal na panahon sa bahay, kasama yung pamilya kumain, so parang mas medyo napagana po yung kain natin. So yung gamot po natin, parang hindi na po na-match doon po sa parang naging lifestyle natin. So pwede yun po ang unang dahilan po ng pagtaas ng HbA1c. Pangalawa po, baka nga po dahil nasusundan na natin yung natural progression po ng diabetes, unti-unti na po talagang tataas po yung requirement ng gamot natin. Kaya po napaka-importante po na may regular follow-up sa mga doktor natin. Kasi po para po ma-evaluate saan po kaya tayo, ano po kaya mga naging dahilan, bakit po tumaas yung asukal natin or HbA1c. So para sa ibang nakikinig, ang HbA1c po, ang ibig sabihin po nun ay glycosylated hemoglobin. Yun po ang test na ginagawa natin every 3 months para malaman po kung kontrolado po ba ang sugar ng mga may diabetes o hindi. Generally po, ang gusto natin ay less than 7% para sabihing kontrolado. Meron pong iilang populasyon na gusto natin mas mababa. Ito po yung mga mas batang pasyente, newly diagnosed, wala pong ibang sakit, mas gusto po natin parang mas stringent yung control natin, less than 6.5. So, yung kay ma'am daw po kaya is 7.4. So, medyo mataas po. Pero kung sabi nyo nga po, ngayon lang siya tumaas, dati po 6.5 lagi, pwede po natin alamin kung ano po ang dahilan, ba't siya tumaas po. Kung ma-identify po natin, pwede pong sabi niyo po dahil sa diet or exercise, then pwede po natin pong ayusin muna yon bago tayo magsabi na baka kailangan natin baguhin po yung mga gamot or dagdagan po. Okay? Sasagutin ko po yung weakness ay diamicron nyo po. So marami nga pong pasyente ngayon nawawalan po ng stocks ng diamicron. Pasensya na po, pero naipit po ang shipment ng diamicron. So wala po. Pero meron pong ibang available na katulad lang po din ng diamicron na pwede po natin gamitin in replacement po. Okay?
Yan, thank you very much.
Pwedeng mag-bathroom lang sandali. Because nung pagdating ko kasi dito, I was seen by Dr. somebody Yuson from, baka kilala nyo, si Dr. Yuson, sa medical, saan ba siya? Saan siya? Hindi, doon, sa De Los Santos. And then, nag-prescribe siya sa akin ng Forxiga Basing Duo. Nag-hypotension ako. Then bumalik ako sa kanya, Doc, hindi ko siya kaya. Baka mamatay ako.
Ma'am. Bumaba po ang blood pressure.
Yes. Kasi I'm taking valsartan as well as my maintenance. So, yun. Sabi ko, Doc, maybe if you can change this one. Sabi ko, kasi hindi ko talaga kaya because I believe patients know best. Diba, Doc? Mas alam natin eh. Kaya sabi ko sa kanya, maybe we have to go back to the same that I was taking before. Kasi I used to remember yung doctor ko who is an American, sabi niya sa akin, Annabelle, why do we need to change your medicine if you're comfortable with that? Yun ang parang, yung aking endo. Yun ang parati kong iniisip. Kasi if I'm comfortable with it, why not? Kasi kung mag-hypo naman ako, why should I have to continue? Kasi ayaw niya palitan. So, nagpunta ako sa doctor ko sa it's my right, doctor, di ba? It's the right of the patient. So, nagpunta ako sa doctor ko sa heart center kasi nagpa-follow up din ako doon ng aking kidney. And then, sabi niya sa akin, okay, let us to go ahead with your medication. So, para bang, nung nag-shift ulit ako sa diamicron and itong metformin, mas okay ako as previously. Kaya sabi ko, hindi ko alam if I need to change or we need to try another medicine. Yun lang ang ko, kasi nga, I really wanted to improve. Yun ang gusto kong And I'm doing my best as well na mag-exercise.
Very good.
Before attending my class at 8 o'clock, I do ensure that I need to exercise kahit 15 minutes.
Very good.
15 minutes. And then kasi nung hindi pa tayo pandemic, I do a lot of walking. And
yes,
then,
ma'am. Very good po yan, ma'am.
Follow up kasi ako na estudyante ko sa Amang Rodriguez, I do a lot of walking. Kaya at least, kaya okay yung aking sugar, nito na lang eh. So maybe that is one of the reason. And
yes, ma'am, definitely.
If we could adjust the medication, yun lang siguro, Doc, ang ang aking concern ngayon. To try another new one, and then to see what we can do, yun lang ang gusto ko, Doc. Sabi pa ng doctor ko, yung aming medical doctor sa school, mag-insulin ka. Sabi ko, Doc, I'm not a criteria for insulin. Sinabi ko sa kanya yun.
Yeah.
To lower down my A1C to 5.4. Diba,
yes,
Doc?
Ma'am. Yes po. Actually, tama po lahat ng mga nabanggit niyo po. No? So, nabanggit niyo po exercise. And ang gagawin po natin, ma'am, kagaya po ng nabanggit ni Doc Paulette, no? We would need po, ma'am, to prioritize yung pag-intervene po muna natin ng ating mga pwedeng makontrol before providing additional medications. So, Ma'am Annabelle, thank you very much for joining us today. Hopefully, we were able to respond to some of your concerns. You can actually still connect with Dr. Paulette po even after po this call. And we will actually be moving na po to our next patients po. So, thank you very much, Anna. Thank you very much po. No?
Thank you so much. Thank you thank you.
Yes,
hopefully that I can book for Dr. Paulette for consultation. Okay.
Thank you, Ma'am Annabelle. Have a great evening po. Wow, ang comprehensive ng discussion ni Ma'am kasi talagang someone with 15 years of experience being a diabetes patient. Nagna-notes na si Ma'am, ano ba ang gagawin natin? Yung mga priority concerns nila. Sila Ma'am Leyden, sila Doc Paulette, at sila Doc Gia. But before we move on to our interstitial, actually may pumasok tayong inbox question. And usually, matating itong mga questions natin ganito throughout the week. And we actually have a question from Ma'am Joan General, no? And actually this was sent a couple of days ago. Good day po, no? Sabi nila, we badly need your help. So this is the first question. Hindi na pwede admit yung uncle ko sa NCMH dahil naging COVID facility siya. Maybe we can flash the question here, no? Pag wala po siya sa sarili, nananakit at naninira na siya ng gamit. Sedative po ba ang solution? May registered nurse po siyang anak na pwedeng mag-administer. Please advise po kung ano ang dapat gawin. That was our inbox question number 1, no? So, I think this will go to Doc Joan. Ano po yung pwede nating ma-advise po sa kanya, Doc Joan? Especially during this pandemic po, no?
Oo, yeah. Which is really understandable. Na yung concern ni Ma'am Joan, General, na naging COVID facility ang NCMH temporarily during this time of pandemic. Ma'am, huwag kayong mag-alala kasi meron na tayong telemedicine, di ba? So ngayon, ang ginagamit talaga natin is telemedicine, and you can consult with any psychiatrist naman po through telemedicine. Ito na po talaga ang ginagamit ngayon, especially now, no, na medyo bumalik tayo ulit sa medyo mas restricted pa, no, na quarantine. And na-mention kasi kanina, I think, na nababasa ko dito, hindi na siya pwede mapunta. So, it tells me na baka meron na siyang previous doctor doon sa NCMH, but hindi lang siya nakakapag-follow up now because nag-shift na to COVID, to becoming a COVID facility. So, maganda, tingnan natin kung ano ba yung mga previous medications, kung naiinom pa ba yun, and na ano siya, no? Adherence, yung naiinom palagi ng ating kasama po sa bahay, yung individual po, no, na nangangailangan po ng tulong. And kung meron naman po kayong number ng doctor doon, kasi usually sa prescription pad, no, may number doon, then probably po, pwede nyo tanungin kung nag-consult po si doctor ninyo through telemedicine. Kasi, again, help is available. Ngayon, during this time of pandemic na telemedicine, teleconsultations, e-prescriptions po, yung electronic prescriptions are accepted sa mga drugstores natin, sa mga pharmacy. So, wag pong mawala ng pag-asa kasi pwede nyo pong ipakita yung kung anong ipiprescribe ng doctor niyo through e-prescription. Papakita nyo yon. And agree ako, usually sedatives, but of course, tranquilizers, no? Be it a major or a minor tranquilizer or sedative hypnotics, yung nakakatulong yon sa kanyang pagtulog para pagising niya, mas kalmado po siya. So yes, yun po, no? So kung kaya po, you can look at the old prescriptions and contact niyo yung doctor. Pwede naman po e-prescriptions, electronic prescriptions for now. Or kung talagang emergency, you can call yung NCMH po na crisis hotline. Meron silang crisis hotline which is open 24 hours a day, 7 days a week. Kaya talagang very accessible naman po, no, kung talagang for emergency cases. I'm sure meron kayong number na siguro Dr. Dex, no, in the ano, na pwede sabihin natin, no, kung ano ba 'yun. Usap kasi 'yun, I can't remember, no, but 0917-899 usap. O, di ba? Madaling maalala yung usap, na? So, that's 8727. So, pwede nyo pong tawagan yon, Ma'am Joan, anytime.
All right. From one Joan to another, that was very wonderful of a response, yes. Doc Joan. No? So, thank you very much for that. Actually, we have another patient with us and a couple more questions. But before that, segue tayo ng mabilis for an Alaga Health update. Yan. So, I'll be showing you very quickly yung ating Alaga Health website and how easy it is. Sabi nga ni Ma'am kanina, napakadali daw natin na mag-register sa Alaga Health. So, pakita natin ngayon, no? This is the Alaga Health website. And then, ganito lang, you can actually browse the content. Pinaghirapan po ito ng aming team na para makita niyo po sino po yung mga partners natin, tapos why we do this, no? As well as some of the benefits that you can get. And of course, all of our partners here, even featured by WHO, The Lancet, and the like, no? Pero dito po ipapakita ko sa inyo, dito sa ating itaas, no? Pagdating sa website, pwede niyo po ito sa taas, upper right-hand corner, yung button po ng sign up. Yan, ito po, sign up. Ayan. Yan. Pag-click nyo po ng button, it's going to redirect you to the registration platform. And kagaya naman po ng sabi ni Ma'am Annabel kanina, mabilis lang po. If you're a patient, ito po yung pipindutin. If you're a partner, meaning health professional, diabetes educator ka ba, nurse, doctor, PT, psychometrician, psychologist, or if you're a clinic administrator, meron kang clinic, marami kayong services, you can register for that. So, for example, sa mga viewers po natin, click nyo po yung patient, no? So, punta lang kayo dito, press continue, and then ito po yung ating data privacy. Basahin niyo po ito ng mabuti, no? Ang maganda, hindi niyo po ka makaka-continue kapag hindi niyo po siya binasa hanggang dulo, auto-check siya, and then continue. And just like that, you get to fill in your details na po kaagad. Ganun lang po kabilis. 1, 2, 3, presto, you already have an Alaga Health account. And who knows, maybe next week, kayo naman ang magiging kasama natin dito sa Alaga Health Live because spill ko na ang topic natin next week, nutrition. Kung may issue kayo sa nutrition or probably GI problems or anything like that, kayo ang ating bida next week. And of course, balik na tayo sa ating mga pasyente. Alright, so before we move on, maybe very quickly, Doc Via and Ma'am Leyden, any quick tips for our diabetes patients watching right now before we call on our next patient?
Okay, nag-take down ako kanina, sinasabi ni Ma'am Annabel kanina, no? 15 minutes ang exercise niya. At sabi nga ni Dr. Paulette, dapat 30 minutes in a day. Ngayong pandemic, we emphasize to our people with diabetes, huwag niyong kakalimutan yung 4 dapat Yung exercise, yung ating nutrition, yung ating consultation, di ba? At siguro yung 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 medications natin, they have to adhere. Kasi ngayong COVID, sinasabi nila, wala namang akong ginagawa, di ko na rin inumin yung gamot ko. That's the problem. Yung maintenance nila, akala nila because they're not doing anything, stop nila yon. Hindi Yung exercise, sinasabi na pandemic, kaya hindi ako makapag-exercise. I'm sorry to tell everyone, pero nung pandemic, mas pumayat ako. Why? Because I increased my physical activity myself. Nag-spare ako na talagang 2 hours spending a lot of household chores, including gardening. Yun lang ginawa kong exercise program. Imagine
nyo. Ma'am Leyden.
I decreased actually ng 4 kilograms.
Wow.
Since pandemic. And I just do the household chores kasi nawalan kami ng yaya. Exactly, nakauwi, hindi na nakabalik because of lockdown. So, sino gagawa sa bahay? Di walang iba.
Perfect, Ma'am Leyden.
Then sabi niya, she is 64, I'm 67. So, yun nga lang, wala akong diabetes. I don't want to have diabetes because we have a family of diabetes. Marami kaming, both parents, my father died with complications of diabetes. My mother, wala siyang diabetes, pero lahat ng kapatid niya may diabetes. So, expect mga siblings niya, meron, lahat kami. I have 3 siblings with diabetes already. So, nutrition. Mahilig ngayon ang mga tao. Hello, delivery.
True.
And what is inside that delivery food? Trans fat, yung mga bad fat natin, and high in salt. So, saan pupunta yon when we eat? Siyempre sa katawan natin. Plus, hindi ka nag-exercise. So, what will happen to you? So, for those people with diabetes, please follow the 4 dapat.
Correct. Thank you, ma'am.
Please lang, yung 3 plus consult your doctor. May telehealth tayo. Everybody, you can avail of that telehealth. It's very important. Do not drop your medication. And please, we are unique individual. Kahit pa sabihin mo ang kapitbahay mo ay may iniinom na gamot na bumababa yung kanyang blood sugar, that is not for you. Meron kang sariling gamot para sa'yo. Unique ang bawat isang tao. May kanya-kanya tayong type of medication. Kailangan po, you don't drop your medication. Continue if you want to consult, you can consult. Tama yung sabi ni Dr. Joan, meron tayong prescription na sinasabi. And that is, tinatanggap sa pharmacy talaga yan. It's very important. So please ang ating people with diabetes and those with pre-diabetes, wag nyo nang dagdagan ng statistics natin.
Correct. Thank you, Ma'am
Teka,
Leyden. No?
Meron ako idadagdag, please. Kasi marami tayong nai-stress daw and sometimes the answer for stress management is smoking. Please stop smoking.
Correct. Mamaya siguro
Never.
magbibigay ng tips si Doc Joan on how to better manage stress. Kasi may
Yes,
questions tayo
yes.
dyan
Ano
mamaya,
makita
no?
Yes.
Siguro mamaya Doc Via can also share about her experience in terms of managing patients via telemedicine. But before that, maybe it's already time, no? I can see all of our patients' family members watching right now. Nakikita ko dito sa ating thread, no? Let us welcome to Alaga Health, Sir Dennis Chow.
Hello po sa lahat mga doktor.
Good evening, Sir Dennis. Welcome po.
Good evening. Bale, kwan lang ako, borderline lang yung diabetic ko. 6 nakwan ako ng fasting blood sugar, 6.5, tapos naging 6.7. Okay lang ba mag-IF kung may ganyan? 6.7 yung kwan. Parang borderline na siya.
Yun ang direct to the point yung tanong ni Sir Dennis, no? So yun daw yung latest lab results niya. Sir, ina-advance niyo naman. Next week yung topic natin on nutrition. But the thing is, nutrition is actually a major component of diabetes management. And since nandito na si Doc Paulette. Doc Paulette, any response po? Ito yung mga diets na very famous ngayon. IF, intermittent fasting, or as we used to say before, skipping breakfast. So Doc Paulette, ano po ang ating response kay Doc Dennis? Ay, kay Sir Dennis?
Good evening, sir. Again, Dr. Dominguez, Dr. Paulette. Matanong ko, sir, bakit ka nagpa-fasting blood sugar?
Kasi yung timbang ko mataas kasi dati mga 90, naging 80. Tapos ngayon naging 75, 73 lang.
Okay.
Kasi nag-IF kasi ako, nag-IF.
Oh, okay po.
Pati
So,
may yung isang question pa, Doc, yung kung borderline ba dapat mag-inom ba ng metformin na? Kasi yung dito sa Zamboanga nag-consult kami, pina-prescribe ako ng metformin.
Okay po. Sige po. Sige sir, nabanggit niyo na rin po about kailangan bang bigyan ng gamot ang mga pasyenteng parang borderline, sinasabi niyo, or parang pre-diabetes.
Yes.
Okay po. So una-una po, kapag po nalaman natin na medyo mataas po ang asukal natin, ang kailangan po natin alamin is ano po kaya yung mga dahilan kaya tumaas yung asukal natin. Pwede po bang dahil nga sa pagkain po natin or nakulangan po tayo ng physical activity. Pero maganda rin po maging aware tayo. Meron ba tayong risk factor bakit tumataas yung blood sugar natin? Kasi kailangan natin alamin kung ano po kaya yung mga risk factor na pwede natin i-modify. Tulad po ng timbang, ehersisyo, kunyari po ang hypertension, pagka kinontrol natin, bumababa po ang risk natin. Meron kasi po mga risk factors na hindi na natin mamomodify. So, kapag po may pasyente po ako pumunta sa clinic, sinabi po nilang borderline po ang sugars ko or pre-diabetic po ko, yun po una ko inaalam. Ano po kaya yung mga risk factors ng pasyente ko? Bakit po tumataas ang blood sugars? Kasi po kung meron po mga risk factor na pwede pa namin ayusin, yun muna po ang pinapagawa ko sa kanila. Kunyari po, sobra sa timbang. Sabihin natin, can natin achieve ideal body weight? Kasi alam po natin, pag nag-lose tayo ng timbang natin, at least 5% ng current weight natin, bababa ang blood sugar. So yun muna po ang sinasabi ko sa mga pasyente. Tama naman po, minsan po ino-offer ang metformin sa ilang pasyente, pero meron po itong parang proseso po na pinagdadaanan para po i-recommenda po agad ang metformin. Kasi po ang gusto natin, parang sustainable lifestyle change po. Yung mas magagawa po natin ng matagalan. Kasi metformin po, mataas na sugar, may metformin, baka akala po nila, yun na po ang sagot sa lahat. Kahit po mag-metformin tayo, kung yung pamumuhay po natin or parang lifestyle nga po natin ay hindi po tama, hindi po natin ma-prevent or i-reverse po yung pre-diabetes. Okay? So, konting sagot po sa intermittent fasting kasi siguro si Ma'am, meron din po ma-input sila Ma'am Leyden sa atin. Pero sa intermittent fasting po, medyo yun po yung matatawag natin mga fad diet po ngayon, ano? Pero po, ang unang recommendation pa rin natin is wastong pagkain po, balanse po sana. Ang maganda pa rin pong klase po ng diet or ang klase po ng diet ng pinakamarami ebidensya na patunayan na po ng ilang mga trials na sinasabi natin na nag-safe, effective at makakatulong po sa kalusugan talaga natin, especially po sa heart natin, is yung Mediterranean diet. So yun pa rin po ang highly recommended natin. Sa mga ilang pasyente po sinasabi niya sa akin, Doc, pwede ba ako mag-intermittent fasting? Siguro po, depende po sa kondisyon po ng pasyente. Kung ang pasyente po ay 65 years old, 70 years old, meron na pong sakit sa puso, marami na pong, siguro po hindi na po pwede intermittent fasting. Yung mga fad diet po, kaya po siya tayo na fad diet kasi nga po parang medyo uso po. Medyo uso po siya dahil po sabi nila ang dami daw pong agad-agad na benefits na pwede ibigay. Pero idinidiscuss ko po ito sa pasyente ko. Minsan po, parang gusto lang po nila ng parang jump start para po makapag-diet or makapag-lose ng weight. Pero lagi ko pong sinasabi, kailangan po natin piliin yung sustainable na klase ng pagkain. Kaya ba natin to gawin for the rest of our lives? Gantong klase ng pagkain.
Yan. Ang ganda ng comprehensive ng discussion ni Doc Paulette, no? Yes, Sir Dennis? Yan. So, sir, thank you po dun sa inyong question. Thank you po dun sa inyo pong tanong, sir, no, na hopefully nasagot po ni Doc Paulette. Very important po yung factor ng nutrition pagdating sa pagmamanage ng diabetes. And sir, bago po kayo mag-log off, no, 2 questions lang, sir. Sir, first time niyo po bang manood ng Alaga Health Live?
First time po.
First time. So sana, sir, sa susunod, we can tell more of our friends na manood ng live. And, sir, nag-register kayo or nagpa-register kayo. Gano'n daw kabilis, sir, mag-register sa Alaga Health?
Madali lang, sir.
Dali lang, ilang minutes lang, no, sir? So hopefully, your friends, your family members, mag-register din po sa Alaga Health Live. Malay niyo po, sila yung mabunot din nating next na pasyente natin na live. So thank you and good evening, Sir Dennis. Magandang gabi po.
Thank you.
Thank you, sir.
Alright, thank you for that. And nako, I think we still have enough time kasi we have one more inbox question. At ito, this one's a biggie, no? So, maybe we can flash this also. This inbox question is actually from Ma'am Jen Leopoldo. I hope you're watching, Ma'am Jen. No, sasagutin po natin yung tanong. And this one it goes like this. Good morning po, pinadalangin ng isang umaga. I'm Jen Leopoldo, 29 years old from Angono, Rizal, asking for livelihood assistance, currently suffering from absence, seizures, depression, and jobless daw siya. My father also PWD with Parkinson's. Hope you can help us. Our heart goes out to you po, ma'am, no? FB lang daw po yung meron siya. And depressed daw po siya for being jobless due to epilepsy. Hope you can help us. Nako, Doc Joan, mukhang meron pong kailangang assistance when it comes to mental health. Kasi joblessness, tapos meron siyang iniindang sakit. Plus, mukhang siya din ay nag-aalaga din ng family member na may sakit, especially during the pandemic. Ano pong ma-advise po natin sa kanya, Doc Joan?
Yes, thank you very much, Ma'am Jen, for your question. Tatlo ang ma-advise ko, di ba? Tatlo para lang straight to the point, no? First is, of course, never let your disability po, yung the epilepsy, depression, define kung ano ang kaya niyong gawin in life. Of course, you are more beyond pa po kayo, beyond your disability po, the epilepsy, depression. Wag pong gawin natin to limit us. No? Hopefully po, Ma'am Jen, ma-realize natin na ang dami pa natin pwedeng gawin. For example po, now is the time to be creative. Especially lahat tayo, I'm sure, no, marami tayong mga skills, talents po, na which you can do kahit sa bahay, Ma'am Jen. So, creativity, meaning po, kung kaya nyo po, no, may mga e-commerce na opportunities now, like online selling, kung kaya nyo po magluto, which you can always, no, pwede mong source of livelihood yun, magluto, and then ibibenta siya. I'm sure marami po ang tatangkilik niyan or magre-raise ng mga plants, and then pwede nyo pong ibenta yung mga potted plants ninyo, or kung ang talent ninyo is mag-painting, o di ba, ibenta nyo ang mga painting ninyo, mga drawings. I'm sure marami po, no? Be creative. Number 2, yung nasabi nyo po, no, kasi you're also taking care of your father na PWD. Ang epilepsy po, ang absence seizure, and of course depression, maari din po tayong kumuha po, no, ng PWD certification po and card, kasi it can also help us po. May mga may tutulong din po 'yon, kasi these are disabilities po na pasok po, and we can ask for help po, no, para makakuha din tayo ng card na may malaking tulong po 'yon. It can really assist us po because, no, of the mga po doon, mga provisions ng isang kung meron po tayo ng PW card. And lastly po, the third tip po na pwede ko mabigay, Ma'am Jen, is of course, you can definitely din po seek opportunities. I'm sure may mga opportunities din po ng profession or work po na hindi masyadong mag-pose ng risk for someone po na may epilepsy. No? Kasi yun kasi po ang binabantayan, no, na wag tayong wag atakihin tayo ng absence seizure or epilepsy sa trabaho. So I think po may mga opportunity po, yun ang hanapin natin kung saan tayo pwedeng mag-seek ng employment or work po na hindi masyadong magpo-pose ng risk sa atin pong sa atin pong physical, medical, and mental health concerns. So yun po yung 3 tips ko po. So definitely po, again, you are more than the disabilities po, and it should not define kung ano po ang kaya niyong gawin in life.
Nako, sobrang sakto naman, Doc Joan, kasi we are still at the tail end of the National Disability Prevention and Rehabilitation Week, o continuation from last week. So, correct. Sobrang perfect. Kasi disability is not just what you can see. Sometimes it's also what you feel. Yung image of disability natin must be expanded. So, may idadagdag ka ba, Doc V, sa mga nabanggit ni Doc Joan? Kasi we saw here, managing patient, at the same time being a patient themselves. So as a primary care champion, ano ang pwede mo sigurong madagdag, even to our patients with diabetes na probably kailangan din ng additional tips?
Yeah, at the center of it all, no, we have to give primary importance doon sa ating kalusugan pa rin in terms of the preventive side, no? Kasi maraming parang comorbidities, no, maraming concerns na si ma'am regarding not only her health but the health of her family members, her loved ones. So importante pa rin po na despite everything po, we still care for our physical health. Importante po yung tips na binigay kanina ni Doc Paulette tsaka ni Doc Joan as well as ni Ma'am Leyden, no, in caring for your health. Importante po dun yung diet, most especially, because we would always advise, no, that diet or the food that you eat is part of your healthy regimen, because food can be your medicine. Importante po that you eat balanced diet, no? And important rin po that we watch out for yung mga kung paano po ginagawa yung food natin. Importante po yun kasi minsan napapasobra po tayo ng sugar, napapasobra rin po tayo ng salt, no? So importante po yun kasi napapangalagaan po natin ang ating mga mahal sa buhay kung naaalagaan natin ang ating mga sarili. And number 2, we always have to consult our doctors for any concerns po. Huwag po nating sarilihin yung problema natin, especially po pag yung concern natin is about our health, no? So nandyan po yung mga experts natin, sila Doc Paulette, Doc Joan, as well as sila Ma'am Leyden and Doc Dex to help us po. And of course, Alaga Health is always there, no, available anytime, anywhere, in every way. We're just one click away, no, in terms of getting consults, no, from any doctor po, be it primary care or specialty or other areas po, no, na may concerns po tayo. So yun po, ma'am.
All right, thank you, Doc Via, no? And since we're talking about championing health and wellness, maybe it's time for our last segment, Alagang Hello, Doctor. All right. So, welcome again to our last segment, Alagang Hello Doctor. And as you all know, Alaga Health is partnered with Hello Dr. PH, and they are the Philippine chapter of the Hello Health Group that's present in over 9 countries. Nako, ang tinding partnership nito. And ang maganda, we'll be sharing with you yet another wonderful article from their website. So, flash natin siya ngayon. Okay, so our article for this week ay ito, Best Exercises for Diabetics, Low Impact, High Yield by ito, registered pharmacist. Yan. Si Ma'am Stephanie Nicole Nera. So, all of the articles that you will see in hellodoctor.com.ph ay medically verified and health checked by our health professionals. So, as you can see here, ayan, no? It explains what diabetes is, why they need to exercise, those with diabetes, how to lose excess weight, improve insulin sensitivity, burn carbs. Nako, siguro pwedeng gamitin ding material to nila Ma'am Leyden, no? Reduce complications and even some exercise. Ang ganda, may mga kasama pa siya mga infographics, yan. And ito, mga sample exercises, jogging, swimming, etc. So you can actually check these articles there, and may BMI calculator pa sila, no? That is already easily available. And ang maganda, they also have so many other articles on their website that you can browse through. So instead of just randomly sharing information na hindi kayo sure kung saan siya nanggaling, and mas maganda siguro na kukunin niyo na yung information from hellodoctor.com.ph. So, pagdating sa healthcare services, you have Alaga Health. Pagdating naman sa health information, you have Hello Doctor. And ang maganda, Alaga Health Partners app is even available now on the Alaga Health website, as well as Google Play Store and iOS Store or the App Store. So thank you for that. That's all we have for Alagang Hello Doctor. So, nako, it looks like we're about to run out of time again. It's almost 9 o'clock. Maybe that means we have to go and have our wrap up. Okay, so it's time for the Alaga Health wrap-up. So maybe this is the time that we ask for the final words of our special guests today. And since it's the National Diabetes Awareness Week, maybe we can start with the wonderful Ma'am Leyden Florido. Final words or any events that you would like to invite our viewers to, anything that you would like to promote, Ma'am Leyden?
Okay, promotion. We have a convention this coming August 19, 20, and 21 for healthcare professionals. Also, if you want something or you want to talk to someone, a diabetes educator, you can just log into our FB page, which is PADE. Just type in PADE and you will get to our FB page. And for all those people who are listening and watching right now, please follow doctor's advice and do not forget to do your exercise and your balanced diet. That is the best diet that you can have. So again, thank you so much for inviting me here, and please do watch and do consult your doctor. Thank you.
All right, thank you, Ma'am Leyden. And since talking about health and wellness, maybe Doc Via can come in with some last-minute tips.
All right, no? Again, to all our viewers po, sa lahat po ng nanonood ng Alaga Health Live at patuloy pong nagsusubaybay sa amin every Saturday po. Maraming salamat po sa pagtangkilik, and I hope na marami po kayong matututunan sa mga information, no, sa mga tips ng ating mga specialists and of course our guests, no. And one of the things I wanted to emphasize always is at the heart po ng pangangalaga natin ng ating kalusugan is always prevention, no. Maigi po na before pa natin maramdaman ang kung anumang concern natin sa katawan, maganda po na nape-prevent natin siya at the get-go, no. We can start, no, not only within ourselves but also within our homes, no. Nutrition starts at home, as well as wellness, no. Caring for our mental well-being starts at home. So always po prioritize or make prevention or preventive measures part of your daily activities, no. Make it part of the choices that you do every day po. kahit lang po sa paggising sa umaga, no, mas pipiliin po nating maglakad, no, doon sa ating mga garden o doon sa kahit po yung simpleng household chores is enough, no, for us to be able to keep our lifestyle healthy, no, and of course always spend time with your loved ones, no, kasi it does not only make us more connected with them, it also helps our well-being be more healthy, no. So and of course always consult your doctor sa anumang tanong po, no. Available na po yung mga information that is given by our doctors. So when we just make ourselves, no, or choose to ask our doctor whenever we have concerns, and always care for your health, no, stay healthy, and stay positive. And maraming salamat po ulit sa pagtangkilik sa Alaga Health Live. Again, Alaga Health, congratulations. And may we have many more episodes sana, no, para mas marami pa tayong matulungan. And magkita-kita po tayo ulit sa isa na namang Alaga Health Live next week, 8 p.m. to 9 p.m. po, dito lang sa Parent Talk Media and Alaga Health. Thank you po.
Thank you for that, Doc Via. And of course, no, the next one who's going to give her final set of responses and even tips ay ang ating celebrity psychiatrist. And mag-mini announcement na po ako sa lahat ng ating mga viewers na laging nag-request ng mental health consult or ng mental health advice. Nako, at the heart of Alaga Health's mental health campaign, I see Doc Joan Perez-Rifareal. And because of that, and I think hindi pa rin niya to alam, in development na po ngayon ang very first spin-off ng Alaga Health Live, which is Alaga Health Live presents Happy Hour Healthy Mind with Doc Joan and Doc Via. And that is coming up very, very soon. We're hoping that you would all be excited to become part of that program as well, particularly focused on mental health. So, with that being said, Doc Joan, final tips and messages po sa ating mga viewers.
Yes, maraming salamat Dr. Dex, Dr. Via, and of course the Alaga Health team. Ngayon ko lang narinig yun. Yes, and bonggang-bongga, thank you for the opportunity. Ngayon ko lang, oo nga, medyo na ano ko. Yeah, thank you very much for the opportunity. Really, I'm so very grateful to Alaga Health. I consider you as my family. Maraming salamat po. And of course, again, I would like to emphasize, again, 3 points lang po as my final take-home messages. Number 1, let's give equal importance to our mental health and physical and social health and well-being. Of course, diabetes is no exemption to the rule. So, pati ang diabetes, in fact, hindi natin napag-usapan to, but studies have shown na mataas ang association ng diabetes with mental health concerns, specifically po anxiety, depression, and eating disorders and body dysmorphic disorders. So, meron silang bidirectional na rules, no? So meron kung tayo ay may mental health concerns, it can make us more at risk to having mga symptoms or complications of diabetes and vice versa. So that's why really this is a very good platform to remind everyone na collaboration pa rin ang key. Always, we need to collaborate and work together. No? Kaya it's always a multidisciplinary approach because that is the best way, no, to attain that optimal state of health and well-being for everyone, especially for those with diabetes. And of course, number 2, yung kaninang sinabi na question kaya ni Ma'am Jen, for everyone po na who is going through rough times, difficult times, challenging times, be it because of a mental health problem or concern or a medical, which involves the physical health and well-being, do not let it stop you. Do not let your disabilities or medical problems define kung ano ang kaya nyong i-attain, kung anong kaya nyong i-achieve. Of course, you are more than your concerns, medical problems, and disabilities. And lastly po, wag mawala ng pag-asa. Help is always available. Not just from Alaga Health, but yung sinabi ko kanina na crisis hotlines, meron po talaga, no? And we use this telemedicine now as a way, no, to continue to be able to extend our help and reach out to everyone because walang iwanan. We are all in this together, and definitely we do this together as one family and one community. So maraming salamat po, and stay safe everyone, especially sa panahon ngayon na medyo maulan. Thank you po.
Thank you, Doc Joan, and watch out for her spin-off show with Alaga Health. Very exciting. So, last but not the least, it is her first time joining us here in Alaga Health, and it has been a wonderful experience. Our first live show with patients asking questions live. So, very memorable and probably historic ito for Alaga Health. And
hopefully we'll have her again, no?
Yes, of course.
Doc
No?
Paulette, yeah.
Probably her final thoughts and things to promote. Doc Paulette.
Thank you, Dex and Doc Dia. Actually, I would like to thank Alaga Health because this is another avenue for patients access to right information. So, lagi namin sinasabi, tamang impormasyon laban para sa kahit anumang sakit. So, for diabetes. So, marami po kasi sa mga pasyente natin, di ba? Dahil marami na po parang sila nababasa. So, minsan, yun ang nasusunod nila or ginagawa na. So, very thankful they have a new way on how to access right information for the different illnesses or parang different issues that they're interested in. For the diabetes, gaya ko sinasabi sa mga pasyente ko, if we have diabetes, it's not really, hindi siya yung parang katapusan ng lahat. Okay? It's also, diba, parang feel it's also a disability, diba, ma'am? Parang feeling na disabled sa because they have diabetes. But I always tell them, diabetes, baka hindi natin siya mapagaling, baka hindi natin siya masabing mag-remission or mawala, but we can control, especially if we do it very early. And very important sinabi ni Doc Via na bago pa siguro tayo humantong sa diabetes, the prevention is really the key. If we know we have the risk factors, mataas ang chance natin magkaroon ng diabetes, umaksyon na tayo agad-agad. And for more information actually, para matulungan yung mga pasyente, they can also go to the Facebook page ng Philippine Society of Endocrinology, Diabetes, and Metabolism for mga infographics that they can look for or parang watch para matulungan sila sa mga common questions nila about endocrinologic problems. And again, thank you again for inviting me to join this wonderful talk.
Thank you very much, Doc Paulette. And there you have it, no? Time really does fly when you are learning a lot and getting your questions answered and, of course, having fun. So, nako, it's time to end the show. So, just as always, kita-kita po ulit tayo sa susunod na Sabado para na naman po sa isang maganda at exciting na episode ng libreng konsultasyon at masayang usapan dito lamang po sa Alaga Health Live. And as I mentioned a while ago, next week, nako, mga healthy food, healthy drink buffs naman po ang ating focus dahil we will be celebrating Nutrition Month. And nako, lahat po ng mga champions in terms of eating right and staying fit and being well, sila po ang ating mga focus. GI problems, baka diabetes ulit, hypertension, and so many other things na may connection sa food. Kayo po ang ating mga bida. At ako, I'm very, very excited for this. So we will be celebrating Nutrition Month and we hope that you will join us. Muli, ako po si Doc Dex Galban na nagpapaalala na alagaan ang kalusugan para mas umunlad ang ating bayan. Muli, ito po ang Alaga Health Live. Bye po. Good evening.